What is seen in zinc-free alloys? These zinc-free alloys are brittle and they're less plastic, that means they're less workable. They are only used in cases where moisture contamination cannot be controlled. Only used in cases where moisture contamination cannot be controlled. Now, what are such examples of situations? Subgingival lesions, retrograde root canal, patients having excess salivation, patients having excessive salivation. Now, coming on to the fourth, which is strength. It has enough compressive strength so that it can withstand normal masticatory forces. Coming on to the fifth property, which is tensile strength. It fractures very easily. Coming on to sixth, which is creep. This is an important short note as well. Now, what is creep of dental amalgam? Creep is defined as time dependent plastic deformation. Now, this basically means, what is the significance? It is related to significance. It is related to the marginal deformation in low copper alloys. If more is the creep, more will be the marginal deformation. Now, if it is occurring at a constant stress, if creep under constant stress, it is called a static creep. If the creep is under intermittent stress, it is called as dynamic creep. What are the factors that affect creep? What we see is gamma 1 phase, which is the Ag2Hg3 phase. It decreases creep, whereas gamma 2 phase, which is the weaker one, that is SN8Hg, it increases creep. Therefore, what we see is in unicompositional alloys or single composition alloys, we see there is a complete elimination of the gamma 2 phase, due to which there is very less creep and there is decrease in the marginal deformation. Now, what do we have to do if we need increased strength and decreased creep? First of all, the Hg to alloy ratio should be minimum. As I mentioned earlier, if the properties of the alloy are better, are good, are not inferior, we require less amount of Hg. So here we are telling the same thing, that Hg and alloy ratio should be minimum, means you should use less amount of mercury. Then the condensation pressure should be maximum. And careful attention should be paid to the timing of trituration or condensation. Coming on to the seventh property, which is retention. What we see is amalgam does not bond with the tooth structure itself. It bonds very less. The retention is very less. So what we require is mechanical lockings to provide retention. Now coming on to the eighth, tarnish and corrosion. This is one of the disadvantages also of amalgam. This is mainly observed because of the formation of silver sulfide Ag2S or AgS, because of the black color which is formed by AgS, and this AgS is formed under many factors. Factors like sulfide containing diet of the patient, or high residual mercury, or when dissimilar contact of the metals has been established, and you could also write moisture contamination. Now, what to do if you have tarnish and corrosion? The factors that you can control upon is mercury alloy ratio to be correct. I'll explain about mercury alloy ratio in another video to be corrected, and you can do much more. Then the last property is biological property. Here I'll just tell a brief about biological property of mercury. I'll make another video which will be based on entirely on this, because we see that the mercury, it releases vapors when triturated or condensed. These vapors can be easily inhaled and cause toxicity. Now, what happens on contact with mercury? What it does is it produces type 4 hypersensitivity reaction, which is the delayed type hypersensitivity reaction, contact dermatitis, delayed hypersensitivity, or it can also cause oral lichenoid reaction.